Hello everyone. If we talk about the purpose of healthcare industry, so we all are well aware that this industry is to heal people, to provide treatment and to increase their quality of life. Now, if you analyze the situation, so till 2019, this industry was moving at a snail speed in joining the global digital evolution. But then there was a villain's entry in this healthcare industry. Do we know all about it? Any guesses? So it is the deadly coronavirus, the super real life villain of healthcare industry. Now, although it was a villain, but it has made us realize the importance of health in our lives. And at the same time, we have also realized that there must be an effective system for the management of healthcare industry. So as we say, necessity is the mother of all invention. This super villain has speed up the development of the concept called digital health. Now the question comes, what is digital health? It refers to the combination of medical knowledge with IT application, IT technologies, so that medical care and supervision of patients could be improved. In simple words, if I explain it, so it is just using the technology for healthcare services. Interestingly, digitization of healthcare is an amazing concept, and somewhere COVID-19 has forced us to adopt it. In just few months of lockdown, we all have become a pro in using digital platform, be it Arogya Setu or telemedicine portals. Today we are getting the medicine delivered at our doorsteps, and that too with wonderful discounts and offers. So if your loved ones are staying far from your place and you get their essential medicines at their doorstep, you feel extremely happy that day. This hassle-free online pharmacy industry has seen super expansion, not only the medicine but the online appointments and teleconsultations with medical experts have made our lives easy. Touching the remotest of areas through COVID and other digital platform has emerged as a wonderful example of digital health revolution. We have never think of such fast development in our remote areas of India, but fortunately it's all true. As we all know that the Indian geographical and population boundaries are the biggest variables, and the only positive step to manage it is digitization of healthcare services. It means inclusion of available IT tools in healthcare segment. Realizing the need and scope of digital healthcare solution, even the government of India has also rolled out the National Digital Health Mission. It is an initiative where government is trying to bring the healthcare records online so that the efficiency of hospital in delivering services may be improved. Digitization makes it easier for patients to maintain a proper history. Best part is that you do not need to maintain each and every page of your last clinical prescription, and this is of course amazing because I know it is very difficult to maintain those prescriptions. But in this case, digitization helps by keeping the doctors informed about the patient's medical history in every situation. A digital file on one's medical history will be handy and will be helpful for people who need different specialists. Moreover, it would be a great help during the emergency situation because the doctor will have the entire health data of a person before treating in just a click. With the help of digitization, we can get the real-time information for any healthcare project, services and its availability, and on the basis of these digital records it will be easy to design area specific health policies. And the best part is that these policies will further help in facilitating the another amazing concept, which is preventive healthcare. And I must tell that this preventive healthcare, which is a smarter concept of managing one's health, is going to be the future of the healthcare system. Now, if we talk about the implementation, so we must understand that although the centralization of healthcare services is very important, but at the same time, implementation and availability of this centralized health services in a decentralized manner will surely help to curtail many health issues at micro level. For example, as we have seen during COVID, district magistrate of some of the district had created different stories compared to the rest of the state. So in India, municipalities and village panchayat can not only have the access to the information from central system but can also take effective decision independently as per their ground level situations. Moreover, if we talk about the technology, so there is another important development which can help this digitization to speed up. It is the efforts to bring 5G technology. So we do look forward to have an easy and better access to the concept of virtual reality in the healthcare sector too. So the thing which seems to be impossible due to some kind of geographical limitation and a healthcare professional is the only respite. It can be eased with the virtual reality. It can indeed do a miracle for medical training as well as pain management, rehabilitation and even physical therapies. So this digitization is definitely going to be a catalyst which is going to interconnect all the unique and fruitful concept of healthcare industry and help us to transform the industry with increased operational efficiency, remote care, home care and of course the advanced care.